How do I protect my family from active TB? Imagine a tiny bacteria that can hide in your body and sometimes cause serious illness. That bacteria is tuberculosis, or TB. Protecting your family from active TB involves understanding how it spreads and taking practical steps to prevent infection. Active TB is contagious and spreads through the air. When someone with infectious TB coughs, sneezes, or talks, they releases tiny droplets containing bacteria. These droplets can be inhaled by others nearby, especially in enclosed spaces. So the first step is to know that early diagnosis and treatment are vital. If someone in your home shows symptoms like a persistent cough lasting more than 2 weeks, weight loss, night sweats, or fever, they should see a healthcare provider promptly. Proper treatment with prescribed antibiotics for the full duration usually makes the person non-infectious within a few weeks. Following the treatment plan exactly as prescribed, sometimes with supervision from healthcare workers, helps ensure the person is cured and less likely to spread TB. Good respiratory hygiene is also essential. The person with TB should cover their mouth and nose with a tissue or their elbow when coughing or sneezing. Tissues should be disposed of properly. Improving indoor air quality by opening windows or using fans helps disperse infectious droplets. Spending time outdoors in fresh air is even better for reducing the risk of transmission. Limiting close contact with the infected person during active disease is important. The person with TB should sleep in a separate room and avoid sharing spaces as much as possible. While family members do not usually need to wear masks at home, visitors and healthcare workers should wear appropriate masks to prevent spread. The person with active TB should avoid public places like work, school, or religious gatherings until a healthcare provider confirms they are no longer infectious. They should also avoid public transportation to protect others. Screening and testing family members who have been exposed is crucial. A healthcare provider can perform a tuberculin skin test or blood test, and possibly a chest X-ray, to check for latent or active TB. Early detection allows for preventive treatment, especially for children or those with weakened immune systems, which can stop the disease from developing further. If a family member is found to have latent TB infection, taking antibiotics as prescribed for several months can prevent it from becoming active TB disease. This preventive treatment is especially important for young children and people with compromised immune systems. Staying informed about TB symptoms and following public health advice helps everyone stay safe. If anyone develops symptoms like a cough, weight loss, night sweats, or fever, they should seek medical advice promptly. In summary, protecting your family from active TB involves early diagnosis and treatment of infected individuals, practicing good respiratory hygiene, improving indoor air quality, limiting close contact during infectious periods, and screening and providing preventive treatment to those exposed. Always work closely with healthcare professionals and public health authorities to ensure the best care and follow-up. Remember, each person's situation is unique, so personalized medical advice is key to keeping your family safe.